This isn't supposed to be about gun control. It's supposed to be about helping people find their way out of the kind of misery that makes death seem preferable. It's supposed to be about suicide prevention measures and infrastructure that could really help Vermonters in crisis. And we're going to talk about those things. Because suicide in Vermont is a serious issue, not to be used by politicians as a device for pushing their favorite agendas. And with the primary suicide prevention measure currently under consideration by the Vermont legislature being a waiting period for firearms purchases, we are forced, yet again, to talk about gun control. The preponderance of evidence generated by a large amount of research points toward the ineffectiveness of waiting periods for firearm purchases in reducing gun deaths. Repeated studies have found no measurable statistical effects on gun deaths following the implementation of waiting period laws. One study, published in 2000 in the Journal of the American Medical Association, indicated that these policies may be associated with a small reduction in the rate of gun suicide for those aged 55 and older, but noted increases in other suicide methods, in a possible substitution effect, resulting in no reduction in the rate of suicide overall. In contrast to the broad body of research, one 2017 study, often cited by gun control proponents, claims that waiting period laws applied exclusively to handguns caused a 17% reduction in gun homicides and a 7 to 11% reduction in gun suicides. In peer review, it has been noted that this study failed to account for relevant variables, relied upon statistical comparisons geographically rather than temporally to determine effect, and measured change cumulatively over periods of time, rather than looking for the statistical cliff that should be evident with a policy whose full effect would become apparent within the length of the waiting period itself. The vast majority of research done on the subject is in agreement that these policies cannot be shown to have caused any decrease in firearm-related deaths, and a report from the Center for Disease Control found insufficient evidence for any determination that waiting periods measurably impact firearm fatalities, noting the inconsistent evidence of effectiveness and limitations in design and execution of available studies. But the purpose of the proposal in Vermont is really limited to preventing suicide. When we look at the numbers at the national level, the greatest correlation with suicide rate is not the extent of gun control laws. It's population density. The suicide rate in the United States is 14 per 100,000. Vermont's is higher than average, at 17.2. But if you controlled for Vermont's demographic makeup and the high proportion of populations at increased risk for suicide, it is actually about average. But how much could a waiting period decrease Vermont's suicide rate? According to the CDC, there were 1,308 suicides in Vermont between 2005 and 2018. During that time, the number of reported cases of the method of suicide being a firearm purchased the same day was 1. Vermont is suffering through a mental health care shortage of crisis proportions. Vermonters wait months or years for appointments with mental health care professionals. Vermonters in crisis seek care through hospital emergency departments, and some have been turned away, returned home, and killed themselves or others. In the absence of mental health care facilities to meet community needs, our emergency departments are so overcrowded with mental health patients for whom no other space can be found, that people suffering massive internal bleeding from car accidents have waited several life-threatening hours for a physician to triage them, and scheduled surgeries have been postponed indefinitely. There is enormous room for improvement in this area, and the legislature has the power to act decisively. That the primary suicide prevention effort in a state with woefully inadequate mental health care resources is a misguided gun control law with over $56,000 in lobbyist spending behind it in the first 2 months of this year alone, which under the best of circumstances can only impact 0.07% of Vermont suicides, is immoral, inhumane, and profane under the circumstances. So what can be done? The Vermont Suicide Prevention Center has a list of recommendations, which include building integrated mental health and suicide prevention infrastructure, improving access and coordination of mental health and substance abuse services, and development of programs to promote social and emotional wellness, and provide training to community members and professionals on how to recognize suicide-related behaviors and how to intervene. All of these are within the power of the legislature, but many of them will cost money. Other recommendations can be implemented quickly and inexpensively. These include the Gun Shop Project, a cooperative initiative between the Vermont Suicide Prevention Center and the Vermont Federation of Sportsmen's Clubs to educate firearms retailers about the signs of a person in crisis. It is also recommended that the media be careful about how and how much they report on the issue of suicide. More than 50 studies have found that certain types of news coverage can increase the likelihood of suicide in vulnerable individuals, resulting in suicide contagion or copycat suicides. The media recommendations include: avoid big and sensational headlines and prominent placement of suicide in the story. Avoid including photos of the method of death and grieving family and friends. Avoid describing recent suicides as an epidemic, skyrocketing, or other strong terms. Avoid describing a suicide as inexplicable or without warning. Avoid quotes or interviews about the causes of suicide with non-experts in suicide prevention. But what about us? What can we do? The most important thing is to educate ourselves about suicide. Studies show that suicide very rarely occurs without warning. One event in a person's life cannot explain the complex causes of suicidal behavior. Common explanations for suicide are isolation, stressors, inability to seek help from loved ones or from mental health professionals, and lack of access to mental health services. With education about what to look for, friends, family, and even a person who is or may become in crisis can intervene, making suicide preventable and the underlying issues treatable. Here are some of the warning signs of suicide. Please go to the Vermont Suicide Prevention Center's website and learn more about suicide as a public health issue and about how to get involved in suicide prevention in Vermont. If you or someone you know is displaying any of these warning signs, here are some things you can do to get help. If you believe there may be an immediate cause for concern because you or someone you know is depressed or having thoughts of self-harm, call 1-800-273-TALK or text VT to 741-741. Take care of yourselves, Vermonters, and take care of one another.